Hello and welcome to the finale of this special week-long virtual edition of CREWCONNECT Global. I hope many of you have found value, insight and innovation in the content our fantastic speakers have shared every day this week. We've covered multiple topics, geographical nuance and views from varying industry lenses. And the good news is it's not over yet. Today we've got a fantastic lineup of sessions focusing on mental health and well-being. And in just a moment I'll hand you over to John Adams to lead us through today's headline panel discussion. Many of you have been interacting with the sessions and each other throughout the week, which is great to see, and we want to make sure today is no different. So please do use the Q&A and chat functions on the right hand side of your screen to send your questions in, and the panel will do their best to get to as many of them as they can within the next hour. And don't forget, you can also use this platform to find and connect with each other. So please do take a look and virtually network as best you can. Finally, I want to say a big thank you to all our sponsors. You can find all their company profiles in the platform, learn more about their excellent service propositions and connect directly with their teams. So that's enough from me. It gives me great pleasure to hand you over to V-Ships UK Managing Director, John Adams.
Good day, everyone. And obviously I'm saying good day because I'm talking across the many time zones there is CREWCONNECT Global. And just to recap a little bit on what Chris has been saying, it has been a fantastic week. From those of you who have been with us since Monday when we opened the session on day one with an industry-leading panel on COVID, crewing, the new normal 2022 and beyond, into day two, we had started off with the subject matter experts on recruitment and retention, and then raising the Philippines flag with the Philippines focus on day three, and really giving us something to look forward to when we go back to Manila next year live to have this in person, face to face. And then yesterday with another industry leading panel on safety and training. So I think this demonstrates that this conference, as always, has the right topics, the right discussion, and the right people. And I think that's also true today, where we move into that subject matter which has been underlying all these points during the week, which is crew welfare and well-being. And nothing can be more important than that in the industry today. And I think it also, I would just like to make the point that when I look at the headline session for today, where it's saying long-term impact of the pandemic and getting back on track, that is very appropriate, of course, very right that we should do that. But it also occurs to me that we were beginning to do a lot of work on this topic pre-COVID, when we would look at things such as isolation, disconnection, communication or no communication for our seafarers, fatigue, bullying, harassment, financial worries, family worries, the environment that people were working in. But now we can take all of that, to put this in some perspective, and magnify that with the power of whatever number you choose to apply to it, 100, whatever, that we now have with the COVID situation overlaying what was already a complex matter for us to deal with. I'm extremely pleased to have the panel that we have today, some of whom I've worked and interacted with before on this topic, and each of them care deeply about this topic and its many aspects, and we'll hear those different viewpoints from them. So each of them in turn, we have Andrew Wright of the Mission to Seafarers, we have Jason Zudima, who's Executive Director of the North American Maritime Ministry Association and International Christian Maritime Association, the ICMA. We have Katie Higginbotham from the ITF Seafarers Trust. And we have Penny Blackburn, Dr. Penny Blackburn, clinical psychologist and consultant, to give us that perspective to this as well. So I'm going to come to each of them in turn, as we normally would do in these discussions, to give them 5 minutes to give us their take on the topic and how they're looking at the world and how they're looking at this issue longer term and how we can get back on track. So if I could first of all come to Andrew Wright. Andrew, the next 5 minutes is yours to lay out how you're looking at things, and the floor is yours, Andrew.
Good day from me, John, and thanks very much for having me. And it's great to be with you all. Obviously, Secretary General of the Mission to Seafarers, and this topic of the long-term impacts of the pandemic are very, very high on my agenda. Spending a lot of time thinking about it for reasons which I'll say in a moment. I mean, some of the dilemmas ahead have been illustrated and highlighted overnight in the UK, where I am, with the banning of flights again from 6 countries because of a worrying new variant emerging. And it's just a reminder of, exactly where is this thing going and how long is it going to go on, and will there ever be a new normal? I mean, it seems to me that the dilemmas are really large. But I think, in broad terms, I thought there was a very symbolic moment during the pandemic, during 2020, when the MT Iber, a ship which had been abandoned, many of you know this story, for a long time, off the coast of Dubai, was washed ashore in a storm on the beach, and what had been a very invisible matter became a very visible matter, I think, to the benefit of the resolution of that case. But it was symbolic of something much deeper for me, which was that, so often, as we often have commented in the past, seafarers have been so invisible, and that the part they play in everyday lives of everybody on the planet, it has been forgotten. And I think there has been, during the pandemic, because of a whole series of factors, at least at some level, that visibility has been heightened. And I think that's been one of the great things. And I'm hoping in the long term that'll be one of the things that changes for the long term. I fear it might not, but I hope it will. And I think 2 levels, particularly there, of course, everyone on this panel will be desperately hoping that there will be a full resolution of the crew change issue, and of course of the essential worker status issue, recognition by all governments consistently everywhere of the importance of seafarers and the facilitation of things that have become very difficult during the pandemic. So I'm really hoping that will be one long-term impact, and I know that is a primary focus of the shipping industry. At the second level, and I've said this many times, I salute the efforts of so many within shipping, so many ways in which people have stepped up to develop a whole new series of things to support seafarers, to intervene on seafarers' behalves, to develop new protocols and systems to support well-being and so on. There has been a lot of activity in that area, and seafarers, in a sense, have become very visible even within the industry. And some of the challenges they face, even in normal times, accentuated by the pandemic, have been very significantly recognised, and a lot of action has been taken. And one of my primary hopes, and all of us at Mission to Seafarers and far beyond, I know, is that those things, again, those lessons will not be forgotten, but that will become a primary focus, as we see it having done over these last few months, in terms of actions taken within the industry and beyond, in order to safeguard and preserve seafarer well-being, both in responsive ways when there are issues, but more importantly, perhaps, in terms of changing things that will prevent problems happening in the first place. And there's various measures that could be taken on that front. So that would be that's one aspect of what I want to say. The second thing, very quickly, in terms of setting the scene, is, and this is obviously very important for us at Mission to Seafarers and for all maritime welfare operators around the world, and that is, how is seafarer behaviour, how is regulation going to change into the future? I mean, much of our work has been based around our work in centres, hospitality centres, our transport work as we've taken seafarers from ships to centres or beyond to local communities, alongside, of course, ship visitation, which has continued throughout the pandemic, but in a very different way. At the gangway, lots of shopping delivery, lots of medicine delivery, interventions where there's been crisis, and so on. But I think there's a very, very big question for us, and it's being asked. We some of our centres have been closed, for almost 2 years now, or no seafarers have been coming because they haven't been allowed to or haven't chosen to come ashore. So, I think this is a very big question for us and many others. Shore leave is really, really important for seafarers. So I know there's quite a bit of frustration amongst numbers of seafarers that even though they've been vaccinated, restrictions are still in place for them. And this obviously has an impact on welfare and well-being. So I pose a question, really, to appropriate question for this conference. How is that going to go forward in the future? How are we going to facilitate shore leave in an appropriate way, even if this thing drags on for many months or even years? And that's going to become a primary question in terms of seafarer care and in terms of the way that many of us will need to respond. I think that's where in terms of scene setting introduction, John, I think that's probably where we are. Lots more to say, but looking forward to hearing from others.
No, I think that's great, Andrew. Thank you. I think that probably there's enough there to unpack already in terms of all the points that you've touched on in terms of the actions required, action taken, behaviours, the centres, shore leave. I'm sure we hear a lot more about, and that key workers. But as I say, enough points there to get us thinking. So I think what we'll do is to zip through the rest of the panel in the same way that we've started. So I'd like to come to you next, Jason, maybe perhaps to give an outline of what you're currently looking at, what your experience has been recently, and how you see it longer term. Jason, the floor is yours, please.
Thank you, John, and thank you everyone else for being on this panel. It's great to be with you today. So I am very to hear the various points that Andrew has raised, and look forward to what my other panelists are going to focus on. I'd like to focus my initial comments on the question of vaccination. Now, there's lots to unpack in vaccination and seafarer vaccination, whether it's vaccine hesitancy or vaccine booster shots, or there's lots of other questions. A really big one is certification for vaccine. How do you get a QR code when you're internationally, when you're sailing internationally, et cetera? All of these are really tough questions. But the thing I want to focus on is just the vaccine supply, the raw supply of vaccine, and this has been a real challenge in the last number of months. The real challenge is that vaccinations on the whole around the world are given to nationals, are given to people that reside in your own country. And seafarers, therefore, to get access to vaccinations, need to get those as foreigners in other countries. That only started in the United States in about April or May of this year, and then other countries have now joined the global vaccination campaign for seafarers. It's wonderful to see lots of new countries joining. Just yesterday, Panama finally announced that they will be joining the vaccination campaign of foreign seafarers, and so starting early December for ships that are Panamanian flagged, will be able to get vaccination through that country. But I want to break down just briefly the challenges that we have here. It's great that so many countries have joined, and it's an amazing testimony to partnerships between governments, health authorities, companies, unions, local ITF inspectors, for example, that I've worked with in so many different places, and then maritime missions of all kinds around the world have been involved in this. Indeed, in Panama, just as an example, it was the Mission to Seafarers that made the formal request to get the vaccine made available in Panama. So that's wonderful to see all the people involved in this. But to break it down more, just to see the size of the problem, the United Nations Conference on Trade and Development, UNCTAD, put out their review of maritime transport on 18th of November, and they said that vaccination is their #1 priority. This above lots of other really big priorities, but this the vaccination of the world was their #1 priority. If we do a little bit of maths, it's early morning for me, but I'll try to do a little bit of maths. The Global Maritime Forum puts out the Neptune Declaration Crew Change Indicator, and on November the 1st, they had a number of 41% of seafarers had been vaccinated. Admittedly, they're only counting about, I think it's about 90 or 100,000 seafarers, but I think the 41% number, the ratio number, probably works. When we compare that to the BIMCO ICS Seafarer Workforce Survey 2021, which listed about 1.89 million seafarers, so if we take 41% of 1.89 million seafarers, we still have more than 1 million seafarers that need to be vaccinated, meaning we've done the initial sprint, but we still have the marathon ahead of us. So all of the efforts that we've collectively put into this as companies and countries and health authorities and unions and seafarers welfare providers still put us only at 41%. 41% is amazing, but it means we have a lot of work to do. We are in for a marathon, not for a sprint. And so I encourage everyone to keep the positive pressure on governments to make sure that vaccinations happen, because we need to make vaccinations available not just to our local populations, the people resident or citizen of our country, but in order to make this happen, we need to also vaccinate foreigners, including foreign seafarers.
Jason, thank you very much. I think, again, this, similar to Andrew's opening statements, this is provoking a lot of thoughts, and just perhaps, because I'm sure others listening in will be thinking the same. But 41%, I agree, it still means there's a lot to do. And I think that's your key message. There's another statistic around from ICS saying that it's somewhere between 25 and 30% that's been vaccinated. Again, let's not get bogged down in percentages. Your point is still the same. There's a lot still to be done. And I think it's governments, yes, but I think there's also social media, misinformation and education we need to bring to this. US, as you've said, just to underline that point, have done a great job in what they've done with vaccinations so far. And that's been copied in parts of Northern Europe as well. But a lot of like-minded arrangements needed elsewhere in order to get this done. It's a huge issue, and thank you for raising it. We'll come back to that in the context of this discussion. So again, continuing through the rest of our panel, I would now like to welcome Katie Higginbotham, who is the head of the ITF Seafarer Trust. And I know that, Katie, you're committed in a lot of areas concerning the welfare of our seafarers. So please, the floor is yours.
Thank you very much, John. And thank you very much to everyone on the panel and everyone on the call for joining this really important session. So as John said, I'm the head of the ITF Seafarers Trust. We're a UK registered charity closely associated with the International Transport Workers Federation. All our funding comes from them. Looking at this enormous subject, last year for us, it was all about the response to the emergency and the huge importance of keeping the fantastic services that the welfare people that are that Andrew and Jason work with, to keep them able to operate and able to maintain the brilliant services that they run for seafarers open and coping. This year, we're kind of beyond the emergency situation, and we're into this what's called the new normal, but really is just I think, you know, further down the line of what does this mean? What does this mean to seafarers and to companies to operate during a pandemic? So what we've recently done is a series of structured interviews with seafarers to sort of check whether we're kind of on track and whether our priorities are the same as theirs. And I think actually one thing that's quite interesting that I just thought the other day was that the pandemic has caused all of us to spend a lot of time at home in lockdown and to change our way of working. And maybe that gives us a little bit more of an empathy with the idea of seafarers being stuck on vessels and not able to interact at will in the way that we've been accustomed to doing. And I think the underlying theme that came out of our interviews with seafarers was a kind of feeling that, you know, are seafarers really valued enough for professional people working at sea, playing such a critical role in global supply chains? I think it's true to say that there was extraordinary cooperation between the industry, the welfare organisations, the unions, charities. You know, in the maritime sector, people really did come together to try and respond to this. But still, the crew change crisis was appalling, was astonishing that so many people could be abandoned for such a long time at sea, and the expectation on them was so high. So I think, although Andrew says, you know, visibility is heightened, I think that's true. Visibility of seafarers within the maritime industry has been heightened by this challenge, but still a huge amount of work to do to raise that profile outside of maritime and make sure that governments are not endlessly not taking into account the critical role that seafarers play. The other thing that really came out during the interviews with these seafarers was the importance of connectivity. Obviously, with the lockdown and with the difficulty of crew change, companies did a great job in increasing the access to internet for seafarers, which was appreciated by seafarers and which really should become the norm. I think we're in a situation now where the technology is there and it's a kind of question of economics. And I think it's important that that continues for seafarers, but equally, it's important that that doesn't replace the right to shore leave. That's the second issue that came out as really critically important for seafarers, is that part of the joy of the job is to interact with other people and see other parts of the world. And that can't be lost. And seafarers, I think, are actually really responsible. I don't think there is a huge risk that seafarers are going to go and interact with people inappropriately. They're very well aware of the situation that they're in and the risks that could, the interaction with people in a COVID situation could cause for crew. So I think that needs to be really thought about, that we don't allow the response to the pandemic to erode some of the essential support for seafarers in terms of shore leave and access to welfare facilities ashore, which then of course ties into the support for mental health and well-being. And I just, before I finish, want to come back on momentarily on the issue of vaccinations. We in the trust, we've been having kind of since COVID, we've been having monthly catch-ups with the leadership of the major labour supply unions around the world to keep abreast of what's going on in terms of crew change and vaccinations. And certainly my feedback is that there isn't a huge amount of vaccine hesitancy among seafarers. Even if there was vaccine hesitancy, it would be overcome because of the need to get employment. So I think more is the question of actual access to doses of vaccines in the countries where the seafarers can get them, whether that's in their home countries or abroad. I think it's more about access and less about hesitancy. So I will stop there. Thank you.
Katie, thank you very much. Again, a lot of food for thought there. What's sticking with me out of those comments, which we'll return to, is this feeling of empathy. And I suppose begging the question, is that strong enough, that empathy? And the other key question you raise is, are our seafarers, even after all this, valued enough, even after all we've been through? And I think that's a key point we've got to get back to. But again, moving on to give our final panel member an opportunity to lay out a viewpoint on this. I'd like to come to Dr. Penny Blackburn and get your psychologist's view of it, what you've experienced and what you're facing and how you see it going forward. Penny, please go ahead.
Thanks very much, John. Yes, as John said, I'm a clinical psychologist, a consultant clinical psychologist, and for the last 5-6 years, I've been working as an independent practitioner in the maritime sector. And I started after I was invited to speak at the ITF Seafarers Trust Conference from a humanitarian perspective. I'd been working in the humanitarian sector, and I was invited there to speak about how we work with mental health in the humanitarian sector. But the only reason I accepted the invitation was because my father is a seafarer, and he was a master mariner, and I grew up in a seafaring household. So I had a sort of interest in what was happening in mental health in the field. So since then, I've been working supporting mental health and well-being in the shipping industry. And one of the things that I've done, something that it was close to my heart, was around policy and guidance, excuse me, for shipping companies and operators around mental health and well-being. At that time, so that was published with ISWAN in November 2020. And at that time, there had been some research from the CERC Centre that more than 90% of the companies that they had surveyed had not made any changes to systems or policies around mental health in the last 10 years. So this was, this is fairly worrying. But then the pandemic hit. And as other panelists have said, we became awareness of mental health in the maritime industry, in shipping, in seafarers, was starting to build pre-pandemic. So the pandemic, of course, has had a major impact on all of us in all kinds of ways. And one of the key things, obviously for me, that's come out of it is that highlighting, that illumination of issues around mental health for seafarers, mental health and well-being. But this is not new. This is a shining a light on the issues that were actually already there. And there was a study that the ITF commissioned of Yale University that looked at the number of seafarers struggling with their mental health, and it did a screening of anxiety and depression. And the key thing there for me, although the numbers were high and were fairly alarming, and I'm sure we could talk more about that if you want to, but the key thing that came out there was the number one thing that impacted on the mental health of seafarers was a non-caring company culture. Now, for me, that's really important. So how do seafarers on the vessels feel they're being cared about by their companies, by their employers? Now, we've talked a lot about how invisible seafarers were pre-pandemic, and I think they still are in many ways for the general population, people who don't work in shipping. But I think what's really important and perhaps a bit provocative is to say that actually a lot of seafarers felt abandoned during the pandemic. And they were stuck on board, as we've said. We all know how the crew change crisis had a major impact on people. But actually one thing that was going on, and I was working both with seafarers and with shoreside staff at the time through many trainings that I was doing in mental health awareness, what was really clear was that, of course, shoreside, there was a massive international collaboration trying to get seafarers recognised as key workers and to, address those issues of crew change. But actually seafarers, on the other hand, weren't hearing about that. And I'd also do some support of the I-SWAN Seafarer Help team, and the numbers of callers during the pandemic tripled. And the number of people expressing suicidal ideation doubled during that period. But one of the questions that people were continuously asking were basic facts around what was going on. And what was really clear is that companies weren't communicating with seafarers on board vessels. So everybody was running around trying to solve problems, which was brilliant, but that wasn't being communicated. And so people felt abandoned, even when companies were actually working really hard to do stuff to solve the problem. So for me, this is one of the key messages that came out of the pandemic, was around communication between shoreside and seafarers, and being able to recognise what seafarers' needs are and being able to respond to them, communicating them openly and with transparency. That in itself would make people feel more cared for, more cared about. The other thing that I'd like to say is that from my time in the humanitarian sector, one of the concepts we have about disaster recovery is the concept of build back better. And it's a really useful concept, I think, because what it does, it looks at the vulnerabilities towards the impact of a disaster and how that can act as a catalyst to actually build better systems, more resilience into the process, more safety, more stability, and better processes, systems, and structures. So for me, what would be really key is for companies to think about their mental health policies, to look at what are the risks to mental health on board in your particular context, to look at how can we promote well-being, how can we create a mentally healthy environment on board vessels, and what systems have we got in place to respond when people are struggling. Those things together, I think, would make a huge difference to people. And I think we've shown that collaboration across agencies, across stakeholders, has been really effective during the pandemic. And that's what we need in terms of mental health and well-being. We need collaboration so that we can identify best practice and we can implement it as widely as possible. But I do also want to say just briefly that it's really important that when thinking about mental health policies, systems, structures, responses, that we consult mental health professionals, because it's like any other technical area that actually you can do harm in terms of mental health and well-being. So it's really important to make sure that what systems and structures you put into place are ones that are not going to do harm and that actually are going to support people. So that's my tuppence worth to kick off with, John. Thanks very much.
Slightly more than tuppence worth, I would say, but thank you. Thank you very much. No, again, I think that was absolutely fantastic in terms of giving us this focus on the real impact of what it is we have to deal with here. There's a number of questions which are coming in. Some of them are very specific, I would say, on vaccinations, and there's a few other points here which are made. I will get to them and try and fit it into our dialogue. But for all of you listening in, I think it's right that I reflect on what I've heard so far and try to determine the direction to take this discussion. What is jumping out at me, and that I think, Penny, you've talked about it, is the collaboration that's required. And it takes me back to the discussion on Monday in the opening session about what how does this look going forward? And collaboration has been mentioned a lot, and was mentioned a lot by the panel at that time also, as to being something that has been an outcome of dealing with the pandemic and with the crisis, is that many stakeholders have come together, we have collaborated. But I'm thinking now to the questions raised by Katie in her comments and with Penny in her comments, but what about that value for seafarers? What are we doing to actually support them, to put in place for that? I'm thinking, Andrew and Jason, that to your comments, I get the feeling that, and Andrew specifically, that when your people are trying to help seafarers, that actually, I think you used the word intervention, which means we already have an issue that we're dealing with. It already is an issue by the time your people are involved in trying to provide that support to seafarers, which is compounded or exacerbated by the fact that seafarers can't get ashore or won't come ashore in the way they did before. So there's something, and maybe it's tied into that question that gets asked, and something that we've all talked about, is mental health the responsibility of individuals or companies or regulators? Who is going to accept responsibility and accountability for that? And I threw back a question on Monday just to say that winning this battle to have our seafarers acknowledged, accepted as key workers, have we even done that across our industry? Do we have arrangements in place to say that if as you say, Penny, if the perception is that feeling, more than a perception, the reality of being abandoned and feeling abandoned, what do we do to build back better on that, to use your words as that approach? I mean, maybe I'll come back and ask some questions to the panel, trying to focus on this side of it from what we experienced 20 months ago. This is already a long time I've been dealing with this, to what we're experiencing today and to what we're looking at the future. I suppose the question I have to throw back, and each panelist can take it in whichever way it resonates with you, but do we feel that the other stakeholders in this, the companies, the employers, or the regulators, or governments, are doing enough for our seafarers, to recognize them, to value them enough, to use your words, Katie? Maybe I can come to you with that, Katie, because you'll be getting a lot of feedback on this. Do you think we're doing enough as an industry for our seafarers? We have to now walk the walk, or whatever all these people in Glasgow at COP26 were saying to us. But the same thing is, it's now time to walk the walk and deliver on this. And is enough happening? We're not just paying lip service. We have to, now is the time for action and tangible outcomes. Are you seeing enough, Katie, from where your viewpoint is?
Well, I think I'm obviously going to say no. I think it's good. It is good that that the industry and parts of the industry and parts of the welfare organisations and the unions have come together to collaborate and have produced a lot of really good policy material, really good guidance on how to kind of work together to get through these kind of difficulties. But I can't help but think that the industry as a whole prefers a soft touch on regulation, and as a result has kept itself somewhat to itself, and hasn't had the lobbying power to open up the world when it came to the crew change crisis. So I think the industry as a whole has to decide how strong a voice it can generate in the kind of wider world in order to avoid this situation. I think it's a kind of human rights outrage, really, that the crew change crisis came to pass, and all of those hundreds of thousands of seafarers and all of the knock-on impact on their families of them not being able to get home. And there must be a huge impetus now for the industry to build up their profile and have a bigger say, because they're so fundamental to global supply chains. So I think it's now an interesting moment to see the impact of the logistical challenges on supply chains, and whether the industry itself is going to raise the issue of seafarers as the critical workers in the supply chain, rather than just looking at the economic and the kind of logistical issues. So I think that's a sort of a structural factor of the industry that has contributed to where we've ended up. In reverse, the very same thing has caused a lot of collaboration and cooperation within the maritime industry, which is good. But I think we need to really reflect on that kind of bigger picture, and not accept that seafarers themselves end up in this situation where they have to kind of suck up all of the consequences of national governments prioritizing their own nationals when it comes to this sort of situation.
Yeah, absolutely. I think a lot of things to think about there. Andrew, that your organization, what you're seeing, what you understand is happening, what would you like to say to those various stakeholders, governments, companies, or how would you like to phrase it?
Well, there is no doubt that this has got to be a collaborative effort. You've talked a lot about that. It's got to be something we all do together. Absolutely, what Katie said, that I think the industry has been shocked by its own impotence when it came to the crew change crisis, and clearly there are going to need to be some careful thinking done as to how that is taken forward, and how that can be. How we can make sure that never happens again if something similar happens, and indeed, in the next year, 2 years, to make sure that we are in a situation where seafarers can be guaranteed transit rights in civilized and respectful ways. So I think that it has got to be a collaborative effort. I think that I am heartened by the collaboration, and we've been pleased to be part of that, and we have seen some great common working across the industry, or at least parts of the industry, and that has been, although there's been a lot of impotence, there has been significant benefit from that. One of my concerns is that as we pass through into the coming months, that some of that fragments and flakes, and I think we have got to make sure that coming together, that common working, that shared voice is sustained, because that is the thing that's going to give up power to this, and it's the thing that's going to help seafarers. But I think that in terms of the valuing of seafarers, I think this. You mentioned it, John. There is a danger that it's done in a reactive way. That it's done. Coping with crisis, responding to crisis, and clearly, what we do need to make sure is that the systems are in place and training is in place. I mean, we've talked a lot about the need for much enhanced, of course, Penny will be expert on this, much enhanced resilience training. Our view is that despite all the help we can give, the primary people who can help seafarers are themselves. They're often out there on their own as crew, particularly through this crisis, when shore leave and so on has been very limited and they've had extended contracts. Knowing how to look after yourself, and knowing how to look after your fellow crew, and recognise, for example, the signs and worrying symptoms of someone may be suicidal and so on. These are critical systems, critical training to be built in on a regular basis to support crews in resilience. And obviously there are wider issues. There are issues around length of contracts, shore leave, as I say. How when in that period between contracts, how can you make sure that time is genuine rest time and is not interspersed with periods of compulsory training that take you away from your family again, and so on. So I mean, there's a whole range of issues which I think are structural issues, which, as Katie said, need to be addressed very fundamentally if crew well-being is protected, and we're not just in the business of trying to come in while after the crisis has happened to try and add in support. And again, I do say a lot has happened. A lot of shipping companies have taken very proactive action to support that process. And I just finally, just to say something about communication, I just absolutely concur. I've talked a lot during the pandemic about that sense of losing control of your own destiny, which is so debilitating. And that sense that seafarers have completely lost control over their situation and not had the communication which has kept them feeling at least a measure of empowerment, that has been very, very important aspect. And just going alongside that has been, one of the things we found is that seafarer families have often been left out of the loop in terms of communication. They haven't sometimes communication with their spouse or family member has been impossible. They've no idea what's going on, and often they haven't had any company contact to sort of keep them in the loop as well. So I think there are key areas of communication which need to be addressed for the long term, which gives seafarers and their families some sense of empowerment and control over their own destinies, because that is something which massively undermines mental health. Probably enough for me from John, but I think collaborative effort for sure.
I think there's a lot of great points there. And I mean, I think the whole perspective of seafarers and their families, something else I want to talk about separately. But Jason, I want to come to you and this question of collaboration and what we can expect others to do. And even if you want to tie that into the vaccination point you're raising, are the other stakeholders doing enough there? I mean, there was a point raised by one of our panelists on Monday who has a responsibility for a large number of Russian seafarers, for example, and that I don't think their vaccination is recognised by the World Health Organization. So is there still greater coordination needed in that sort of area? And are you seeing enough being done by the companies and state and other legislators in helping this general situation, Jason?
Yeah, so the idea of collaboration it's been wonderful, beautiful to see since the beginning of the pandemic. I've had the privilege of collaborating with all sorts of groups that I would have never thought I would have so much collaboration with on a weekly and sometimes daily basis in certain parts of the pandemic, and I think that's all been very positive. So if we focus this idea in the world of vaccination, I think a few things come to the fore. First is what this requires is collaboration by people who haven't necessarily collaborated with each other before. So the ways in which companies and unions and seafarers missions and governments are linking up with each other and having meetings with each other to get vaccinations done is beautiful, but it's a lot of work. It's not just enough for a country to say, okay, yeah, vaccinations are available, come on down, get them. Well, how does a seafarer get to the vaccination center if there is no shore leave? How do the people from the vaccination center get to a ship if it's on board if they have no transportation and no one facilitating that transportation? It's not as easy of just saying, here's a vaccine, take it. But there's all sorts of logistics that need to be overcome that can only overcome with collaboration. So that's the first point. The second point I'd like to say is it's not just collaboration with others, but often, paradoxically, it's collaboration with yourself, with your own company, with your own government. I think from the beginning of the pandemic, it's nice that some sort of high-level person in the government says, yes, seafarers are key workers. Our country wants to have seafarers as key workers. But if that high-level official doesn't communicate that down to the security guard at the airport, doesn't communicate that to the border force or customs and border protection or others who are actually going to be enforcing the green lanes or whatever other facilitation of seafarers, if that's not communicated down to the same organization, if they don't collaborate within their own organization that it doesn't really put any oomph behind the idea of seafarers as being key workers. Seafarers as key workers has a practical impact. It's not just a phrase that we say to pat seafarers on the back, but it needs to have daily practical application. It means crew changes are facilitated. It means that travel to and from countries is facilitated. It means that there are it has to do with quarantine requirements, and it has to do with making vaccination available to foreign seafarers. If key seafarers are key workers, that it means something especially for governments, to put money and time and resources and laws behind it that actually support seafarers. So I think that sort of collaboration, the cost of collaboration between all of us there's a real cost to that. But then it viewed within your own organizations, or especially in governments, collaborating with yourself, making sure that all the people up and down the ladder actually know what's happening.
I think that's a great point. And I think, just to chip in a comment to that, because I'm going to come to Penny with a specific question, but carrying on this theme, but and Katie, you've talked about shore leave and all of that, and I'm very much on board with that. That's a rather bad analogy, but in saying that we should have shore leave in the sense that that's the type of thing that should happen in the normal, in quotation marks, course of a tour of duty. But given the difficulties that we have with transit and getting ashore and all of that, I sometimes, the frame of mind I'm in at the moment is, should we be focusing more on just simply making sure we're able to do timely reliefs to at least get people off on time, and then the shore leave is maybe the part two of it, if we can at least do that, because what was stressing the whole situation is people on board for a year, 2 years, whatever, and now we're managing to get a little bit on top of that. But now we're finding that people, quite rightly, and I know this is a pain point in the industry, so many people ashore who are staying ashore to make sure they get their full leave ashore, quite rightly. So it's like this balance we've lost. We have to get that back into it. My question to you, Penny, is coming back to the whole theme here of collaboration, and what do we think organizations need to do that they're not doing? From your perspective, as a psychologist who's been directly involved in this, and also perhaps, if I can put the question to you, also wearing your ISWAN hat, in the point of view that ISWAN were very active in employee support pre-COVID. Should people be experiencing issues on board ships for all the reasons I gave earlier, whether it just be the harassment, the environment, financial worries, etc., that isolation, not having an outlet, which is a key issue in mental well-being for our seafarers or for anyone, that having that contact person, that employee assistance program. So my question is kind of two ways: is from an ISWAN perspective, and I realize a lot of confidentialities and sensitivities around this, so we can talk about it very broadly, but have you seen an increase of contact from seafarers looking for that help? And the second part of that question would be, what type of help and support should the companies and organizations be putting in place to assist this?
Yes, there's a lot to say on that, John. I think yes, there's been some good collaboration going on. I think we need more. And I was speaking to the CEO of ISWAN recently about this idea of collaboration. And ISWAN is really keen that different welfare agencies are working together so that we can look at, who's good at what, who can offer what, what's our strategic approach to mental health and well-being and welfare more broadly for seafarers, and how can people work together and provide what they're good at and refer to each other and so on. Yeah, during the pandemic, there was a threefold increase in contacts from seafarers to the Seafarer Helpline, and twice as many calls around suicidal ideation. And sadly, the number of suicides has increased as well. But I think also going back to that question about valuing seafarers, I think Are we doing enough? I think there's a lot more that could be done, and I think there's some simple things, some things around facilities on board, for example. You know, if we look at the facilities, the living conditions on board vessels, you know, would you be happy to spend 6 months in the cabins on board your vessels? I don't know, maybe yours are wonderful. And there's something about kind of what are the living conditions like? Also, in terms of recreation and downtime and off time, that ICE1 is at the moment completing some research around social interaction. Social interaction matters, the project is. And they found again that reaffirming that idea that actually, if people are supported to spend recreational time together, that enhances team working and results in fewer accidents and incidents, but also improves people's ability to support each other. And so it works on a number of different levels. So there's all these kinds of things, but there's also simple things like welfare funds and things like, while shore leave is not possible, is it possible for the company to coordinate access to essential and luxury items that people would normally go onshore and get for themselves? The missions do a huge amount to be able to bring things to people, but the companies could be doing some of that as well. And I know some companies are doing that. And some companies are doing really great work in terms of looking at their recreational facilities, of making sure the crew mess is nice, making sure that there is live stream events possible for people to see, or gaming things together, that kind of thing. One of the other things that really stands out for me as well, though, is how the pandemic has highlighted those social and health inequalities, both on shore but also at sea. And as Katie was saying, that we had all those numbers of people stuck on board, but we had an equivalent number of people stuck at home, unable to join vessels. And for the majority of them, particularly the people in India and the Philippines and so on, they weren't being paid during that time. So although our officers may be on full-time kind of contracts, actually a lot of people were not being paid during that whole period of time, and they couldn't feed their families. They couldn't put a roof over their head. There was a massive crisis in terms of just survival and basic needs. Yeah. So there's something around income security and contracts, and whether companies can or would have the will to actually do something about that and demonstrate a commitment to people, as well as to the company, the profit, the business.
Okay, excellent stuff there. And I have to say, on a personal note, I love the idea, Penny, that you're saying all of this, and you're saying it as a clinical psychologist and the work you've done in this, but I love the idea that you're saying, because you have an affinity with this industry through your father and your family and everything else. So you have that other resonance to what you're saying. So I take all that as great information and research that you've done on this. What I'm going to do here is, because we have just under 10 minutes left, and I want to be fair to some of the people that have been posting questions, and I'm just going to take a little bit of liberty as a moderator for this by perhaps trying to answer some of them, because some of them seem to be quite operational. And I've got a question here from Rolly Chaturvedi, talking about the rates of incidents and accidents on board due to the human factor, and how do we tackle this situation. I just want to share, Rolly, that and with the panel, it is a very great point. I mean, because it worried me greatly when we knew people were being stranded on board, and that for extremely long periods of time. I worried a lot about fatigue. I worried a lot about mental well-being in terms of focus, keeping focused. This is a very dangerous, high-risk business. What is operating ships if it's not risk management? So this type of area worried me greatly. If people's mental health are affected and their physical health, would this lead to more accidents? And it was not the finding in 2020, generally speaking. That's not to say that they didn't happen. I'm just talking about spikes and trends and so on. 2021, that challenge has continued, but it continues to be an area where I think companies have at least got a real focus on that. And that, but it is nonetheless a very valid point in the sense that it can be an outcome of the very situation that we're talking about here. A question that came in early on from Jeffrey Annis Tail. I won't go into the details, but talking regrettably about a homicide on board ship. And I think this regrettably, extremely regrettably, is the type of situation we do hear about time by time. And it has happened also pre-COVID, we have to also understand. And I think it also gives, and it's difficult, therefore I won't comment on this issue, this specific one raised, because we all need to know the circumstances of it. We need to know all the various contributing factors to such a situation. However, again, what we have to remain laser focused on is the mental health of our people on board. Are they being affected with this? How are organizations, companies able to get that insight to what's actually happening when they themselves, company themselves, and I've experienced that here and with other colleagues in other organizations, have been unable to get to their ships as often as they would like. They're getting there a little bit better now than they did in 2020, but still they're not getting to ships as often as we like. So that finger on the pulse, that face-to-face interaction with our seafarers on board, because as well as being stranded on board, the one point I do want to always say for our seafarers and the sacrifices that they've made is that they've actually been servicing our business and servicing our clients' business. So I think that it's actually that humanitarian point we've had to focus on, but our seafarers have actually been looking after the economic welfare of this industry as well by delivering our business, quite literally in every sense of that. So again, we want to acknowledge all of that. A couple of questions about vaccinations from Carlton Thomas. Will booster shots be available? My personal feeling is we're not at that stage yet. We're still trying to ramp up on the necessary initial vaccinations. And Marisa Anderson asking about vaccinations in Panama. But I have to confess, Marisa, I don't know the answer to that direct question. But in my experience, I don't know if you know anything on it, Jason, but if you have something on that, maybe you could take that question for us.
Yeah, so booster shots, there are a few places in the United States and in Europe that are already offering booster shots, some of the seafarer vaccination programs. And then on in Panama, it is only for Panama flagged vessels coming in to port, but there might be opportunity in the Colon free zone and also through the international airport for those signing on or signing off of non-Panamanian flagged vessels. But that's not clear yet. The program only starts early December.
Okay, very good, very good. You know, we've only just scratched the surface here. There's actually so much I would like to cover in terms of that range of things that you talked about, Penny. But 30 seconds, and I mean 30 seconds, panel members. Any final comment you'd want to make? We really only have a couple of minutes, and they will switch us off. So don't any more 30 seconds. Andrew, final thought.
I think it's been really, really, really interesting. I think there's so much we could pick up on. Just a word on safety. Obviously, a massive issue. I am very, very encouraged by the Together in Safety initiative, which is really getting legs now, and that really is about collaboration and cooperation in safety. You know, with learnings from the pandemic and before, and I think clearly we're all play a part in that because happy seafarers, good seafarers, happy seafarers make safe seafarers, all that kind of stuff. And I do think that the safety question plays into all this, and I am very encouraged by one or two of the collaboration initiatives going on, particularly Together in Safety.
Thank you, Jason. Final one.
Yeah, this to remember that this is a global big problem, but to consider it that for each seafarer this is a real life issue. That being stuck on board an extra month or two can have big changes in his life. I was speaking to one chaplain this week who was working with a seafarer who's planning his wedding in January, and that seems to be called off because he's going to be on board longer. So part of the thing the local chaplain was doing was the seafarer said, I have to call off my wedding, but if I buy my wife an iPhone, maybe she'll still love me and we can still have the wedding a little bit later. So the ship visitor, the chaplain in this case, bought an iPhone and saved a wedding. So hopefully the wedding will happen a little bit later in 2022.
Absolutely. Well, I won't comment on that, but so many things I'd like to say there, but a wonderful story. Katie, final word. We're probably over time, but final word.
Okay, I'm going to be very precise then. I think keep going with enhanced internet access for seafarers. As Jason has said, it's the most important thing for seafarers to be able to maintain contact with their families. And in doing that, don't give up on shore leave.
Perfect. Penny, your final word. Very brief.
Yeah, no, I'd agree with Katie, and I think the pandemic has shown us all how we absolutely rely on the internet to keep in touch with our friends and our family, especially when we're in lockdown and we're not able to go and help them practically. And that empathy for seafarers, that they're always in that situation. And just finally, that talking to seafarers are our most valuable asset. And talking to them about their well-being and what works for them, they've got brilliant ideas. So keep the conversation going.
Absolutely. Thank you for that. I was about to say that in my wrap-up comment. We always say human resources are our greatest asset. Let's go and prove it. Let's demonstrate it. Let's do it as an industry. Let's demonstrate ourselves that they're our key workers and we support them. I'm going to hand back to Chris now to move on to the next part of the program. My thanks to the panel here. Marvelous panel. Thank you very much. Great questions. It's been a great conference. Again, I wish we had a little bit longer. This is a fantastic subject. It definitely needs more discussion. My thanks to Chris and his team while I got the chance to say so. A fantastic week. I think you've done a great job in keeping this conference to the forefront. And I very much look forward next year to seeing everybody live in Manila and in person. We'll see a lot of maritime events coming back next year in 2022, but this is the flagship conference for this particular subject area across all that we've discussed this week. And I look forward to seeing all of you back in Manila in 2022. My thanks to everyone, and we'll look forward to getting together in person. Thank you, everyone. Back to you, Chris.
Thanks so much, John, and thank you to all the panelists today. What an engaging conversation, and clearly we could have done with a lot longer. So as John says, join us in Manila next year, where hopefully we'll be able to extend that conversation much further past the panel slot. Thank you all for tuning in. As I said at the start, it's good news. We've got 4 excellent sessions still to come over the next hour or so. So please stick around, browse through the platform, connect with each other. A massive thank you to all of our sponsors, as always, for helping us make this virtual week possible. Next up, co-founders of Big Yellow Fish help us better understand how technology and data can help organisations make the invisible visible.